I'm Dr. Brian Nickel, your cannabis expert for CannabisExpertMD.com with a frequently asked question. A little behind on these, going to catch up on at least one today. Franco from Blanco, Oklahoma writes.
Actually, it should as this read Frank.
Just Frank?
Yeah,
Well, Franco sounds better. We'll just
it does.
Okay, yeah. Franco asks, will marijuana help with my arthritis? Simple answer to that question, Frank, is yes, it will help with your arthritis. Getting the best results from cannabis, though, depends a little bit more on the type of arthritis that you're having. If you're having osteoarthritis, the simple wear and tear type of a single joint, let's say an elbow, knee, shoulder, topical CBD preparations like this one here from Buffalo Company, they're very, very effective. They soak into the skin very, very quickly. Effects usually within about 10 minutes. There's no systemic absorption of this, so you don't have to worry about ever feeling impaired about it. Plus, there's only CBD in there anyway. Now, for deeper joints that are affected, like the hips, the spine, the sacroiliac joints, or for patients that have multiple joints involved, or very severe symptoms of osteoarthritis, as well as patients that have the autoimmune arthritis forms such as osteoarthritis or psoriatic arthritis. These patients require cannabinoids in their bloodstream so that they can be distributed to all the tissues where the inflammation is happening. Usually, all these patients do better with systemic absorption, and certainly autoimmune patients have to have that present. As far as the cannabinoids we're considering, CBD is the baseline portion of this. CBD has its own pain-relieving properties, but more importantly, it works indirectly in the endocannabinoid system to bring down inflammation, which is the issue with arthritis. CBG is a very potent anti-inflammatory cannabinoid, works directly on the endocannabinoid system to bring down inflammation. Certainly the combination of CBD and CBG really helps a lot of patients with severe osteoarthritis. Oftentimes they can just get by with CBD alone, however. My patients with autoimmune disorders, all of them, I really recommend that they use a combination of CBD and CBG. Now THC certainly enhances the anti-inflammatory properties of CBD and or CBG through the entourage effect. Usually, most patients have a lower THC dose requirement compared to that of CBD and CBG if they're using it. Oftentimes, patients can use a THC tincture at the same time of administration of a CBD and CBG tincture, or they can use a little inhaled THC around the doses, that is at time of administration and about 45 minutes later, to kind of activate the entourage effect and help it to work better. Now you can get a hold of these symptoms just by smoking flower, doing combinations of CBD flower, THC flower, and possibly CBG flower, mixing together and consuming it by combustion. The problem is the inhaled route of administration is pretty short acting, so you're going to end up having to dose with flower multiple times throughout the day. This is a schedule most people can't really keep up with, and it gets expensive very quickly. Tinctures, by being more potent and longer lasting, really are a better way to address the inflammation that is present all day, every day. By being more potent and longer lasting, they also tend to be a lot more cost effective for these patients. So, Franco, smoking a bit of weed, yeah, that will help your arthritis symptoms. But again, getting the best response, we've got to take a little bit more into consideration. You didn't really tell me what type you had, so I'm just going to give you my general suggestions here. Of course, for a single joint, maybe a couple of joints relatively close to the surface of the skin due to wear and tear osteoarthritis, really topical CBD things, that's my first line of treatment for these patients, at least my first recommendation for them. For patients with deeper joint involvement, spine pain, hip joints, sacroiliac joints, as well as patients with autoimmune disorders, I really recommend you go ahead and go with tinctures, a baseline CBD tincture. For patients with very severe osteoarthritis involving many joints that they can't get a hold of, the addition of CBG to the CBD will probably be of a big benefit. Again, on patients with autoimmune disorders, CBG is going to be an important part of your treatment. I usually recommend a CBD to CBG ratio of anywhere from 2 to 1 to even money on that. The autoimmune patients have a tendency to do better with THC tinctures, but can use a little bit of inhaled cannabis around the doses if they find that sufficient. And now, when it comes to considering the terpenes that are going to be involved...
Actually, we're going to have to cut you off. We have gone over 5 minutes.
Okay. Well, I guess terpenes, that'll be for another day then. Well, I hope you found this information useful, Franco, and everybody else that is having arthritic symptoms. For more information on all things medical cannabis, be sure to check us out at CannabisExpertMD.com. We're also available on YouTube, Instagram, Facebook, and Twitter under CannabisExpertMD.